Most cases of low back pain today are overdiagnosed, over-imaged, and over-labeled. I'm Dr. Ron Fedella. I'm going to show you some literature that supports that and briefly discuss the problems that arise from that. What this recent post from the International Association for the Study of Pain indicates is that 85 to 95% of those who go to their primary care doctor, the doctor cannot determine what part of the anatomy is causing their back pain. Here's another article from the journal Lancet, and notice it says the same thing as what was just illustrated, and that is non-specific low back pain does not have a known identifiable pathoanatomical cause. The three main reasons why it's difficult to precisely diagnose the body part causing the pain are: first, the various structures in the back that are capable of producing pain produce very similar pain patterns. The second, the physical examination procedures used to evaluate an individual have a low degree of reliability and reproducibility. And then the third, images, if they are taken, can be extremely misleading. As an example, here's a rough graphic representation of pain that can be referred from the L3, L4, L5, and S1 discs. What I want you to notice is that although there may be slight differences, they're roughly similar, and in the clinical practice there's a lot more overlap than what's shown in this graphic. Here's an illustration of another major pain-producing structure in the back called the facet joints. Once again, you can see pain can occur in the back, but there is definite referral patterns into the leg. Again, not much different than what you just saw. In this third representation is an example of muscular pain, myofascial pain, or what people call trigger points, consistent with what's already been shown. Notice the pain referral patterns are fairly similar. Moving on to the accuracy, or perhaps I should say inaccuracy, of the clinical examination, I'm going to show you two studies. The first was from 2006 from the Australian Journal of Physical Therapy. They looked at 48 relevant studies that evaluated accuracy in the clinical examination. And note that their summary was that most of the procedures used by clinicians with back pain demonstrate low reliability. Here's a more recent scientific paper, 2023, looking at the accuracy of our clinical exam procedures. This was a huge study. It looked at over 2,000 different research papers, chose the 27 best, and came to the exact same conclusion, meaning the clinical exam procedures that are commonly utilized have low reliability and generally low accuracy. This wasn't pointed out because I think the examination is worthless or shouldn't be performed. You got to start somewhere. But I pointed it out to dispel the commonly held belief that where the back pain is coming from can be specifically diagnosed. It can't. It was my intent to get into imaging in this video. I'm not going to do that because diagnostic imaging, and in particular an MRI, warrants an entire video on its own to illustrate how you can run into false positives, how you can become alarmed at findings on that MRI that mean nothing and are seen in healthy individuals who have never had low back pain, and how over-reliance on the MRI or a diagnostic label can lead to a treatment pathway that is counterproductive